Welcome to Innovating Clinical Trials, the podcast designed for clinical research professionals eager to deepen their understanding of clinical trials through concise, insightful segments. Join your hosts, Eves and Ted Trafford, as they uncover the core issues in clinical research, reflect on the industry, and challenge conventional wisdom.
Hey Ted, how are you doing?
Liam, great to see you.
And you, sir, are you well?
Yeah, it's a beautiful morning. Can't complain. It's nice and calm. The sun is out. The weather, the temperature is fantastic. So, yeah, great summer morning here. How about you?
Amazing. Yeah, no, really good. It's it was actually where we live in Cambridge in the UK. It was the hottest day of the year yesterday. So, as I record this from my outdoor office, it's as you can see, it's like a greenhouse because I'm surrounded by glass. So it was it was nice and toasty yesterday, but thankfully it has cooled off. So I'm in a good place. But I've been having a think as we do, and there's this analogy that came to me after reading a book. I can't remember who it was, and they said something along the lines of "Don't mistake the map for the territory." And yeah, I really like the concept, and I'll go into it in a minute. And I just wanted to sort of share some thoughts as it relates to clinical trials. It's another one of my models that I like to use. I
love hearing about your models. It inspires me to read
sad.
more. Yeah, I clearly don't read enough.
Oh, I just read the strange books. That's yeah, I can only attest to that. It's the strange thinking books. But yeah, so I thought I'd share it, and then you don't have to bore yourself with reading some of the stuff that I've been reading.
Excellent. This will be the audiobook version. Nice.
So basically, I wanted to, as mentioned, explore the concept of, don't mistake the map for the territory in the context of clinical trials. So it's, for me at least, it's a really critical principle for anyone that's involved in the design or the execution, the delivery, shall we say, of the clinical trials. So in essence, it's really about recognizing the differences between our plans or our models and the assumptions, so those being the map, and the reality, which is often complex, which is the territory that we encounter as we're running these trials. So I guess just as a quick explanation, so you want to be thinking really I think of the map as the plan, the clinical trial protocol, the statistical models, initial assumptions that we create to guide us through the process. So they're obviously incredibly valuable as they give us direction, help us outline our goals and provide a framework. However, as we know, they are massively simplified representations of a very complex and dynamic world that we operate in. So the territory represents the actual real world conditions. So the patients we work with, the variability in human biology, unforeseen logistical challenges, even sort of things like regulatory shifts. So if we consider that the protocol is like a map, it's just going to show you where the roads are. It shows you how to get from point A to point B, and there may be even points of interest along the way. But just like a city, is that the reality of conducting these trials can be quite different. So roads can be closed, traffic worse than expected, detours might be necessarily. So with this physical map, if we, so in our plan is that if we just rely on our map or our plan, we become very too rigid in our initial thinking without actually acknowledging these evolving landscapes and the subsequent territories. So we will find ourselves delayed, impacted by changes in protocol and so on and so forth. So I think that actually one of the big things for me is around recognizing that there is a distinction between map and territory, or plan and reality. And this is really the first step of operationally running more and effective trials, But the question then becomes, okay, how do we apply this? So, for instance, flexibility is really important, or being dynamic, as I should say, is really important. So once we understand that our initial plans are just assumptions that could change over time, it becomes very clear that flexibility is critical. So we recognize that actually, things that I love to do is when we're planning out these trials, what are the assumptions that we need to see and assess whether they're truths, or if they are just, assumptions that will turn out to be false as we go along the way. And that's really important, I think, because people can often get very tied up on things that they believe to be true that then therefore aren't. Whereas if you call them out, so if you call them out when you're starting, you can then say, okay, guys, this is not this is not just because you believe this, we've got it called out. We can be tough on the problem, but not on the person. And I think that I don't know about you, it'd be interesting to get your thoughts on this, Ted. Is I found that people can become quite precious about their thoughts, but if they're on a piece of paper that's central, that everyone says, okay, we've thrown our ideas on here, some of them will work, some of them won't, and you can tackle and point to those things, it removes the personal aspects of it, so people are a bit more open to changing their own ideas and thoughts and opinions to adapt.
I think, once you open the vulnerability and set aside the concept that, I have ownership with this idea instead of I'm sharing this idea with others, that it does open up a little bit more to that collaborative approach. And as long as people are open to taking the time to learn from others, I think the map and the territory. I love that. It's really interesting because I was thinking about enrollment as you were talking, and how often we come in with our map for enrollment into a clinical trial, and how often do we actually plan for that enrollment to go sideways?
Yeah.
And, what are we going to do if it doesn't go as planned? Like, we've done everything, what's our backup plan? What's plan B? What's plan C? What if this happens? How often does that type of planning occur?
Yeah. Yeah. And they're wonderful, because I think that there's nothing stopping sending to carry on with the analogy, there's nothing stopping sending a scout out to actually view the terrain before you start. And what I mean by that is there's nothing stopping us trying to stress test some of the assumptions. So a good one, like you said, enrollment is a great example, because there's a host of underpinning data, so prevalence, numbers of patients at site, and so on and so forth, conversion rates. So you can produce a process funnel that is effectively for your enrollment process, right? To say, okay, we think we've got 500 patients, there's going to be a conversion rate of 10%, that are going to come into clinic, and so on and so forth. And we think that's going to produce, 2 patients, let's say. Nothing stopping you stress testing that prior to going live with the study, so that you're then in a better position when you start, and equally to, proactively be modeling different scenarios, so that you can then say, okay, now we're seeing some sort of trigger, if you will, some leading indicator that says we're going off track here. Let's not wait to realize in another 6 weeks that we are off track. We know now, and let's adapt now. I think that that's ultimately the biggest value I see with this model, is that you do it early, you send your scout out to stress test to your point, to get those scenarios, and then you're able to measure and manage leading indicators, not the lagging ones.
Well, it's like when you're using, Google Maps to get somewhere, and Google Maps tells you there's a leading indicator that there is an accident ahead. And maybe you can then, in advance of that, take that second route to get to where you're going. And yeah, you might cost you an extra minute or two, but it didn't cost you 15, 20, half an hour sitting in that traffic jam.
That's exactly what it is. I wish I had thought about that earlier, because that's a great example. It's about being adaptive to it. So yeah, so I think for me is ultimately any strategies around the sort of like the map and territory point to one essential truth, that the real world of trials is really complex, messy, and ever changing. So we should be really embracing this complexity rather than burying it and hope, having hope as our strategy, because I think that is being proactively pessimistic, so that you can be like very, on the ball. At least you'll know if it is going wrong and then adapt to that. So I think that, we've got to remember that while our maps, our protocols, plans, models, etc. are invaluable, they're just tools to guide us. The true test of our success is that, or our success to deliver clinical trials, lies in our ability to navigate the terrain as it really is. It's staying flexible, patient-focused, ready to adapt. So that's my thoughts.
I love that. Yeah, no, that's a great overview of how our plan needs to be bigger than the map.
Yeah.
And we need to really prepare ourselves for the reality that most studies end up outside the map a little bit.
Absolutely.
Amazing.
100%.
Thanks,
cool.
Liam. That was fantastic.
Thank you, sir. Appreciate it. We'll speak soon.
Yeah.
Bye.
Bye.